So, what is CML? Chronic myeloid leukemia, also known as chronic myelogenous leukemia, is a type of leukemia that affects the white blood cells. It causes white blood cell division at an exponential rate and overwhelms your body with white blood cells. There's also something called the acute phase. So CML, it's in the chronic phase. There's also the acute myeloid and acute chronic leukemia. I'll cover those towards the end of the video, but for now we're going to focus on the chronic phase. So there are three main defects and abnormalities that can happen in the chromosomes. There's translocation, inversions, and deletions. We're going to focus on the translocations of chromosomes for now, because that's what causes the CML. So what happens if you think of the chromosomes as a comb with individual teeth, and each tooth represents a different chromosome? What happens is a piece of chromosome 9 breaks off and a piece of chromosome 22 breaks off, and they swap places. And that's called a translocation. It breaks off and they relocate to other places and they refuse on and they create new chromosomes. In CML, this is exceptionally dangerous when the number 9 breaks off and attaches to the number 22. It creates something called the Philadelphia chromosome. Philadelphia chromosome is in about 90 to 95% of patients that have CML. So it's a pretty good indicator that you have CML, and so that's kind of what we'll focus on, is that specific chromosome. So when number 9 attached to number 22, creates that Philadelphia chromosome, and inside that Philadelphia chromosome there is something called the BCR-ABL protein that is formed. So the BCR-ABL gene, it creates a process called phosphorylation, and basically this overrides the body's natural on and off switch for cell division. So for instance, you have a normal white blood cell count between the range of 4 and 10. We have an infection, it might go up to 11 or 12. Your body creates more white blood cells to fight off the infection. When the infection's gone, it turns that switch off and allows you to go back to that normal range of 4 to 10. In CML, with my specific case, my range got all the way up to 600 and 700 range. It was incredibly high, which is very dangerous. And what the BCR-ABL protein does is it overrides that on and off switch, and it just flips it to on. So basically it causes continuous cell division within the white blood cells, and it causes the white blood cells to proliferate throughout the body and overwhelm the body's natural systems. So in the acute phase, not only does it cause the white blood cells to divide, but also causes immature or baby white blood cells to divide as well. And those are called, I believe, blast cells. At which point then your body really becomes overwhelmed with it, and that's called the acute phase, and it's a much more accelerated version of the chronic phase. Going on to treatment, in 2001, a drug called imatinib, Gleevec, was approved for use in the United States, which changed the way that this disease was treated. Until this point, the only treatment was immediate bone marrow transplant with an average life expectancy of about 5 years. However, with the new medicine, it was able to be controlled long term. So Gleevec is known as inhibitor. And what this does, going back to the BCR-ABL protein, it has phosphorylation that occurs around this area, and it sends out a signal to the cancerous cells that causes the white blood cell division. Right here, it causes them to divide, and each one to divide more and more. What Gleevec does is it binds to the end of this protein, effectively inhibiting the phosphorylation from happening, and renders the BCR-ABL protein ineffective and cannot work. Since 2001, they've come out with multiple other types of medications that's able to treat this disease as well. But the original imatinib, Gleevec, was revolutionary in the way that it binds to this protein. And so one of the other medicines they have nowadays, this is one that I have been on, is also known as Tasigna. And with these drugs, they're able to effectively control this disease long term. And since 2001, it has saved thousands of lives. So hopefully this helps somebody who's. I know when I was recently diagnosed, there's a lot of really in-depth, detailed videos. I'll leave a couple links to some that are really good, but it was hard to find something that was just very simple and easy to understand. So I tried to do that in this instance to help other people like myself that were just at a loss for words. And for my friends and family, this is to explain to you what's going on, and I'll be uploading another video shortly explaining my personal story and what is happening with me and what in the process that I'm going to be going through in the following year. So I hope this helped. Have a good day.